diabetic socks. What do they do, and what are the best socks for diabetics? So to understand why we need a special sock for a diabetic, we need to understand what diabetes does to your foot first. So very broadly, a diabetic foot is neurocompromised, so it won't feel very well, and it won't heal very well because it's vascular compromised as well. So what this means is that when you have a raising and lowering of your blood sugar levels, the nerves and the blood vessels in your feet become damaged. So the nerves obviously make your foot not feel very well, and if you damage the blood vessels, the nutrients aren't getting down to the cells of the feet. So your skin and nails and bones and everything they don't heal and repair very well. So what you get set up is we call a diabetic foot an at-risk foot. And what that means, it's at risk of infection. So when we don't feel our feet very well, we're more likely to wear a shoe that's slightly too small, get a blister on the end of our toe, and when we get a blister on the end of the toe, we don't feel it become infected because our sensation is not as good in our feet as a non-diabetic patient. So the infection spreads, and then the infection spreads into the bones, and then we're more likely to have an amputation when we get a bone infection. So a diabetic foot's more likely to get an infection and amputation. So what we aim our diabetic socks at doing is limiting the risk of infection and limiting the risk of amputation. And there's a few simple things we do, and we're going to use the Ergonix diabetic socks here as an example. These are the ones we use in the podiatry clinic. And so the features of the diabetic socks are, these are a silver lined thread. So basically what it does is silver is incorporated into the thread of the socks. So it reduces the bacterial load without actually killing off the natural flora or the bacteria that are meant to live on your feet. So it's a really nice natural way to limit the chance of a bacterial infection in your foot just by using a different sock thread. Now this is not a chemical wash, so it doesn't wash out over the life of the sock. So the silver thread is actually incorporated into the thread, and the silver's a natural antimicrobial. So that's the first thing, the material they're made out of. So we'll start at the top and go down to the bottom. So we've got this really quite loose band at the top of the sock. So this is the mini crew version. We also have a crew or a longer version if you like your socks to be a bit longer. The first thing we look at is the band around the top. So you can actually see this is really quite a nice loose knit, and it's a non-binding cuff. So what diabetic patients usually have a problem with as well is they get swelling around their ankles, and we don't want to cause any sort of pressure or restriction injuries around the ankles. So we have this really nice loose binding around the ankles, so we don't constrict it and cause any injury. The other thing this has got is around the heel section is if we get any slipping, this has got what we call a Y-shaped heel. So the seam in the heel here, it's a blind seam, so you can't actually feel it. But what it is, it's a Y shape, so it actually grips around the side of the heel, so it actually conforms to the shape of a human heel better because it's just slightly more shaped. You can actually see it here. It just bulges out here, and it's got this Y-shaped seam. So that's the second thing. The third thing we look for is we want to go with a sock that's flat seamed. So on the inside of the sock, you can see that there's no actual seam facing towards the inside of the sock. The seam is actually pointing out. So when we put our foot in this sock, there's less chance of irritation from the actual sock or the seam on the sock. So it'll make it a lot less likely to give you blisters or irritation on the toes. This sock also has, if we compare this, if we can see it in the camera, if we compare the top versus the bottom, you can see the bottom of the sock is really quite thick and padded. You can see the padding section starts here, and the top is breathable but still protective, but not too thick. So the other thing we don't want to do is wear a sock that's too thick and actually crush or make the foot too tight in the shoe. This can cause other problems like neuromas and can actually cause blisters. So that's got a cushioned foot side. What this helps to do, it helps to limit the pressure on the feet, so we're less likely to get irritation over the plantar prominences or the bony prominences on your feet, because a diabetic patient is more likely to have plantar fat pad atrophy, where the fat pad actually wears out. So we don't want to cause more pressure than we need to on here. So the padded foot side of the sock is a great one to cushion the foot, and also makes it a lot more comfortable. There's another few features of this sock that we really love. Often in a family you'll have multiple people that are diabetics, so we have the size marking on there. So this is a small size, and that just helps to match them up in the wash a little bit better. So you're not grabbing a sock out particularly when we've got quite a plain white sock. Sometimes they can be difficult to match up out of the wash, so we put the size marking on there. So that's pretty much the long and the short of the diabetic socks that we use in the podiatry clinic. So that's the Ergonix diabetic socks, and you can find these at the Athlete's Foot or online at ergonix.com. If you have any questions or comments, we'd love to hear from you, and we look forward to answering more of your questions. Thanks. If you enjoyed this video, please like and subscribe to our channel. It's very simple to do, and it really does help us out. If you need further information on the topics discussed, please follow the links in the description, and that will take you to our website where we've got more information on these topics. If you have a specific question that you'd like to ask, please comment in the comments section below, and we'll do our best to make a video to address your question. If you have any further comments or questions, you can find us at ergonix.com.au, and we look forward to seeing you in the next video.